Hello. So today our drug is Calcaria Fluor. We are going to study the biochemic drug named Calcaria Fluor today. So let us start now. I hope you have understood previous drug Calcaria Phos. Now when we start one drug, you have to understand or recollect your previous knowledge of biochemics, the principle on which this biochemic group of drugs are working. So common name or the synonym of calcarea fluor is calcium fluoride or calcifluoridum. It is commonly known as fluoride of lime. Common name of calcarea fluor is fluoride of lime. Chemical formula is CaF2. Now calcarea fluor, where it is found? It is found on the surfaces of the bones. Second, it is found in the enamels of the teeth, and it is one of the most important constituent of the elastic fibers and of the epidermis. The elastic fibers are found in the skin, in the connective tissues, and in the vascular walls. So these are the places where elastic fibers are found. Okay. Now, before understanding calcarea fluor, I would like to remind you of one thing. Now, what is the principle of biochemic? It is the principle of deficiency. That doesn't mean that it is whatever deficiency is there in the body, you replace it and with the amount of calcarea fluor and the body becomes healthy. This is not the answer to it. But sometimes there is just deficiency in the equilibrium. There is deficiency in the chain of equilibrium, the calcarea fluor molecules of the body. And that is why the patient shows disturbances. Now, as I told you, calcarea fluor कहाँ मिलता है? Surface of the bones, the enamel of the teeth, and the elastic fibers and the epidermis of the skin. Got it? So whenever there is any disturbance in the equilibrium of the calcarea fluor biochemic cycle, the disturbance will be seen at this level. Got it? The disturbances will be seen at this level. At this level, matlab, there will be some pathology in the bones, there will be some problems with the teeth, or there will be some problem in the vascular structures of the body. So now, further understanding. Jare there is disturbance in the equilibrium of the molecules of calcarea fluor, or whenever there is disturbance in the normal biochemical activity of the calcarea fluor molecule, what you are going to see? You are going to see one. Since there is loss of elasticity, what happens? The relax of it. There will be dilatation of the blood vessels, there will be dilatation of the fibers, there will be dilatation of the lymphatics. Got it? Second, whenever there is disturbance in the equilibrium of the calcarea fluor molecules of the body, you will be seeing chronic relaxation. Chronic relaxation matlab you will see chronic relaxation in the blood vessels, you will be seeing chronic relaxation in the fibers and you will be seeing chronic relaxation in the lymphatics. So whenever such relaxation and dilatation occurs in the body, what happens? There is disturbance in the absorption of the solid exudates. And so what happens? There is disturbance in the absorption of the solid exudates, and actually it doesn't, there will not be any absorption. બરાબર અને એટલે જે solid exudates નું absorption નહીં થાય. And so what happened? It gets deposited. It gets deposited and deposited and deposited, and finally the part gets indurated. So Disturbance in the biochemic cycle of calcarea floor leads to relaxation and dilatation of blood vessels and of the elastic fibers also, and of the lymphatics also. And then what happens? Because of this, there will be uh, no absorption of the solid exudates, and because of this there will be deposition of the solid exudates, and because of this there will be induration of pus. So this is how the calcarea floor disturbances occurs in the body. We see such calcarea floor biochemic disturbances occur in the body in the form of pathological enlargements like hemorrhoids, બરાબર. પછી ટ્યુમર્સ, varicose veins, indurated glands, uterine displacement, and weakness of the abdominal walls. So you see, all this is induration and deposition and relaxation and dilatation. Wherever. So whenever there is calcarea floor disturbances, whenever there is loss of equilibrium of the calcarea floor molecules in the body, we see, I'll tell you in the medical way now, we see hard knotty growths on the surface of the bones. Got it? How this growth have occurred? Because of relaxation, because of chronic dilatation, because of no absorption of the solid exudates, because of induration. So you see, first, anywhere wherever on the bones you see hard knotty growths on the surface of the bones, it calls for calcarea floor. Second, because of the relaxation of the elastic fibers, calcarea floor becomes a very important drug in uterine displacement. Okay, prolapse of uterus, displacement of the uterus. Okay, hanging of the belly of the abdomen, loose and elastic, loss of elasticity. You have to think about calcarea floor. And finally, calcarea floor is also useful in cracks and fissures. Got it? So this is how you understand the pathology. This is how you understand calcarea floor normal and abnormal biochemic cycle. Clear? Now I am going to the guiding symptoms of calcarea floor. All that you need to know about calcarea floor. Got it?